morning, all. My name is Brittany Berlin, and today I will be presenting on the intersections of outer space and global health. For those of you watching the recording, today is June 12th of 2023. So I'd like to start by introducing myself. I'm a rising junior at Florida Atlantic University High School in Boca Raton, Florida, where I am a student researcher under the direction of Dr. Robert Serro. So in the past academic year, I served as the co-president of Advocates for Inclusion and Research, vice president of HOSA, co-director of Advocacy, Healthcare Administration, and Public Health and Medicine for my school's American Medical Student Association chapter. I was a delegate in Model United Nations, as well as the Forbes Student Research's Biology Research Mentor, and I aspire to pursue a career in international health policy. So you are probably wondering right now, how exactly do space and global health correlate? So to understand this relationship, it is important to think about it in three broad aspects. These are as follows: the delivery of healthcare products and services, medical research, and epidemiologic research. So telemedicine is crucial in understanding this relationship and can be defined as any sort of medical information that's exchanged between two or more parties via any type of electronic communication, such as computers, cell phones, or even videos. And this is instrumental in not only improving patient care, but also can be used for educational purposes to educate different physicians on different topics on an international scale. So telemedicine has many benefits, including increases access to healthcare systems for those living in a rural community or an underserved nation. It also reduces costs to not only the healthcare system, but also to patients, which is very important with rising inflation. It can improve communication among physicians and between physicians and patients, and can provide medical education. And this was especially emphasized in 1998 when surgeons from Johns Hopkins University collaborated with Thai physicians via telemedicine to conduct the first laparoscopic colectomy, which was performed in Bangkok, Thailand. So telemedicine has many outcomes, and the results are in the numbers, with 10% of patients experiencing a decrease in hospital mortality, and they save an average of $121 due to avoiding ER services. Studies also report that hospitals save an average of about 11% of their funds and can garner an internal return rate on investment of $3.30 for every $1 spent on a telemedical program. So this all really came to a head in a peak during the COVID-19 pandemic, where space technologies were able to provide an early warning system to prevent future outbreaks of COVID, and this can also be used for any pandemic that may arise in the future. Moreover, geo-tracking and satellite technology were able to help conduct contact tracing and to allow officials to monitor the spread of COVID-19. While all of these innovations really helped government and public health officials, of course, we must also be mindful of privacy concerns. And research performed in space has actually resulted in many medical breakthroughs, such as laser angioplasty to treat cardiovascular disease, digital imaging breast biopsy systems, insulin pumps for diabetics, effective exercise techniques for those who are battling osteoporosis, as well as the studying of the LRRK2 protein for those who have to battle Parkinson's disease. This protein is very hard to study on Earth. However, the microgravitational environment on the ISS allows for scientists to develop a larger replication of the protein, and this broad, high-quality protein replication is able to be studied much easier, and this helps the over 10 million people who battle Parkinson's disease and helps support the creation of a drug designed to help these people. Medical technologies have also been developed in space, including the digital breast mammogram machine, infrared ear thermometer, insulin pump, and left ventricular assist device, also known as the LVAD. So this device was pioneered through a joint effort between engineers at the Johnson Space Center and world-famous cardiothoracic surgeon Dr. Michael DeBakey, and this groundbreaking artificial heart pump was actually designed based off the space shuttle's fuel pumps and allows for hearts to keep pumping for those who are waiting for heart transplants. And remote sensing is also vital in global health and can be defined as any sort of data that is collected from a distance. And this has been especially useful in direct monitoring of infectious microorganisms, mathematical modeling of disease evolution, and tracking of disease vectors to alert at-risk populations of what's around them. And it's also been a vital tool in managing disease outbreaks such as those caused by the Ebola virus, cyanobacteria, tick-borne, waterborne, and mosquito-borne diseases such as malaria. So, malaria is transmitted between a certain type of mosquitoes, and this transmission is closely linked to the prevalence of mosquitoes in various geographical regions, which is directly correlated with rainfall, temperature, altitude, and bodies of water, which serve as mosquito breeding sites. So, while there are many cases of malaria on an international scale, the malaria sensing model was able to curve 500,000 cases in 28 different countries on a worldwide scale. And with all of these innovations occurring in space, it is certainly vital to protect space to help with the global health of the world. And the United States recognized this with the development of the US Space Force. So the US Space Force was created in 2019 as the sixth branch of the US military and was funded with a budget exceeding $2 billion US dollars. And this was the first authorized military branch since 1947. And the UN also recognizes the importance of helping outer space continue to thrive with the development of the United Nations Office for Outer Space Affairs, also known as the UNOOSA. Clearly, vital achievements have been achieved in outer space and have helped with a multitude of medical breakthroughs. It is vital to protect our space so we can continue to thrive on a public health scale. Here are my references. And before concluding today, I'd like to give a few words of thanks, specifically to this conference for not only allowing me to participate, but also to share my findings. I'd also like to thank my family for their endless support, my research mentor, Dr. Robert Serro, my other research mentor, Dr. Tricia Meredith, and the entire research team and faculty at Florida Atlantic University High School. I cannot thank you all enough. And if you have any questions, please feel free to email me at bberlin2021@fau.edu or connect with me via LinkedIn. Thank you so much, and I hope you have a fabulous rest of your afternoon. Thank you.